everyone, and welcome to this edition of the Health and Wellness. My name is Nellie Greer, and I will be your host tonight. In tonight's program, we're going to focus on natural remedies. What you hear today, you probably know already, but maybe have forgotten or aren't applying it. We hear so many quick fixes that we get sidetracked, and we need to rethink our plan. In the past, probably month, I would say, I've had a lot of folks that have come in with different concerns, and I thought of putting something together to address those issues that they can actually take care of and do with natural things that they already have in their kitchen. And one of them being the circulatory disorders, blood clots, cardiovascular conditions. And with it, I'm going to tell you some stories that of people that had good results, and others kind of came to it a bit too late. They ended up reaching out and maybe doing a natural remedy and also doing doctor's care, but they addressed it too late. But anyway, for the circulatory disorders, good circulation is undoubtedly the foundation of good health. However, sluggish or inadequate circulation can result in tissue toxicity, starvation, and eventually cellular death. The damage that poor or inadequate circulation can cause is best illustrated in the gangrene that often develops in the legs and arms of many advanced diabetic patients. Because the blood cannot efficiently circulate through these areas, parts of the tissue literally rot away. Now, I would say that if and when you look at your feet, there's poor circulation, and you start to see darkness on the toes, on the feet, on top, or on the ankles, or on the legs, know that these things are poor circulation. And what happens is you end up feeling more numbness or tingly. The feet are more cold. You can't seem to warm up, or it's just painful. And so there are things that you can use. Niacin is one of them, and niacin is effective for dilating blood vessels and increasing circulation. The amino acid L-Arginine and cayenne pepper have similar properties. Essential oils may be extremely useful for promoting circulation. Essential oils are very immediate. Once you apply them, you get fast results. You don't have to worry about waiting about 10-15 minutes that it gets dissolved in your stomach and delivered to the areas that are needed. Essential oils, once you apply them, and you apply them directly in the areas of concern, you will get quick results. Essential oils may be extremely useful for promoting circulation. Myrtle is one of them. Lemon, cypress have been used to strengthen and dilate capillaries and increase circulation. Now, all those are to increase circulation and to strengthen and to dilate capillaries. Helichrysum, clove, and citrus oils are natural blood thinners. Now, for anyone that's concerned about doing blood thinners or they're taking medication for it, some folks decide they don't want to do that. They don't want to take medication. This is an option for them to do this instead. Although I will say that if you are taking the medication already, this is something that you can do. And I know that folks that are on Coumadin, they can't do greens. So in addition is that if you were to do essential oils, it would help you to be able to, enjoy some of the foods that you like without having to worry, because you're actually addressing it in a different way, added to the way that you're doing with the medication. Helichrysum, clove, citrus oils are natural blood thinners. balancing the viscosity or the thickness of the blood, and they amplify the effects of cypress. Now, cypress creates circulation, and that's one of the oils that's used usually in massage when you want to increase the circulation in whatever area that you're working in or on. Marjoram relaxes muscles and dilates blood vessels, while nutmeg acts as a circulatory stimulant and an anti-inflammatory. Goldenrod is a vein detoxicant, decongestant. Goldenrod is a vein decongestant. Okay. Now, there is a blend that's done if you want to, let's say that you have leg issues or feet or arm issues, hands. You can actually make a circulation blend, and we have a circulation blend that's one, and it involves the basil, marjoram, cypress, and peppermint. That's the first circulation blend. And that is where you do 5 drops of the basil, 8 drops of the marjoram, 10 drops of the cypress, and 3 of the peppermint. That's the first blend. The circulation blend 2 is 3 drops of basil, 2 drops of peppermint, 4 drops of cypress, 8 of marjoram, and 10 drops of wintergreen. And what you do is you take a little cup of some sort, or maybe a jar, and what you do is you put those oils in there, you blend it, and you can use like a carrier oil, like a V6 oil that Young Living sells, or you can use like coconut or olive oil or whatever oil, you know, olive oil or coconut is good, and grapeseed is also good. So for those that want to do that, or you can just do that and apply those directly and not do a carrier oil. I usually use them straight. I don't use a carrier oil because I think that you get the best that way without diluting them. Anyway, that is, and it says to, it's good to, when you're doing this, on the legs especially and feet, direct the strokes to go up to the heart. So meaning when you work on the feet and stuff, make sure that everything that you're doing is leading up to the heart. So it's up strokes rather than down. Also, the circulation support regimen, it says to, you can also take some of these oils and put them in water. Some, like lemon, you can put in water. You can also do some of the other oils that are good, dietary, you can put in capsules, and we have that. But anyway, the next thing that we're going to talk about is for the circulation, the remove stagnation is also good to do. It's an herb that helps in opening up the channels so that the stagnation that is that's developed on the legs open up, and the remove stagnation herbs, you take them, and a lot of time we often say to take one in the morning and then one in the afternoon. Sometimes it's depending on how big the job is, it's better to do one a day, just so that you don't detox so quickly and you're able to tolerate what's going on. The lymph herbs, the Lymphamax and the lymph cleanse, those two oils, I mean those two herbs are good to do also because a lot of times it's lymph drainage that you need as well. So those are herbs that just loosen up things and make things flow better, so that you're removing the toxins that are actually trapped in the lymph glands. And I was going to say too that B-complex, it's really required and needed, because B-complex vitamins, what they do is they help in break down your food so that it gives you energy, and all the B's are in there. So we need B1, B2, B6, B5. They're all in there, and they all assist in giving you energy to break down your food. It's good mental. It's good for anyone that has vertigo, that has issues with dizziness. B complex is really a good one to do. Now, for inflammatory, for inflammatory veins, it's inflammation of the blood veins, usually due to blood clots. Symptoms include pain, tenderness along the course of the vein, discoloration of the skin, inflammatory, swellingness, joint pain, and acute edema below the inflamed site. You know what? These are things that as we get older, because the movement, we're not walking as much, we are sitting more, we're more inactive, we're not racing after children, we're not doing as much. We're sitting more, we're laying more for a lot of us that are sick. So consequently, the less movement, the more stagnation, the more buildup of toxins that are built in the body, and they're not being drained out, and they're not being released. And so consequently, these are all things that start to mount, and it creates a condition. Natural progesterone is an effective anti-inflammatory. So for anyone that has inflammatory veins, like like the veins are popping, or they're very painful, swellingness happens, that's a good one. Juniper, we talked about this back when we did the herbs, and juniper berry, cypress, wintergreen, and tangerine, and aroma life, those are the oils that are good for Phlebitis. It's inflammation of the veins. And also, longevity is also an oil that has frankincense in it, and it has clove, and it has some other different oils on there that helps us. We can actually take it internally in a capsule form, or we can apply it directly on site, or maybe put it on the spine or back, feet, hands. Also, for the varicose veins, we actually talked about this also in one of the programs, and the blue color of the varicose veins is coagulated blood in the surrounding tissue from hemorrhaging of capillaries around the veins. This blood has to be dissolved and reabsorbed. Helichrysum helps dissolve the coagulated blood in the surrounding tissue. We talked about that, how that thins it out. And if you heard back and you remember what I said prior, was that helichrysum is good for the capillaries to get rid of that blood stagnation that's in those areas. So helichrysum, aroma life is good for heart. It's good for cardiovascular. So that's the reason why they have it in there as well. There are different blends for the veins, and that's geranium, 3 to 4 drops, 1 drop of wintergreen, 1 drop of cypress, and 1 drop of helichrysum. That is for the veins. And then I have a little set where it tells you exactly step to step how to do the massage and stuff for the veins. We've had folks that called on, and then I wanted to say too that for cardiovascular, we talked about niacin, amino acid, arginine, cinnamon is another one, cayenne pepper. Those are all good. And I'm going to give you a little drink that you can do, and you can incorporate some of those things so that you end up helping with that as well, because we've had a lot of folks do that, and they've come back and said that it has helped in thinning all that, and their legs are looking so much better, and the feet too. You know, there's a lot of people that a lot of times they have so much pain, and we had one gentleman that said, just amputate my legs. I don't care. They hurt too much. I can't sleep. It's almost like I just want them gone. And I remember that we gave him something to do, and he a little resistant in doing it, but he did it. And the first day that he did it, he just was so amazed that the next day he couldn't wait to do it again. And the third day he did it again, and only to go back to the doctor and let them know that everything was good and he was feeling so much better. So his legs were saved. He didn't have to have the amputation. And so, but anyway, I had a lady that called and wanted said something about that she had osteopenia, and this is it's referred to bone density that is lower than normal peak density, but not low enough to be classified as osteoporosis. Osteoporosis occurs when there is an imbalance between new bone formation and old bone resorption. The body may fail to form enough new bone, or too much old bone may be reabsorbed, or both. Two essential minerals for normal bone formation are calcium and phosphate. That's the reason why it's so important to actually do calcium. And a lot of people are not absorbing calcium, and so because of that, I think doctors are actually saying that not to do calcium anymore because they have too much calcium stored. And the reason why is because the body isn't absorbing and delivering it to where it needs it because there's too much acid in the system. So the idea is that red desert clay will work on that, cleaning the system out from that, so that when the calcium is taken, now the calcium is absorbed to the bone tissue where it's supposed to be, and also to detoxify, and also to neutralize acid. And so red desert clay, calcium phosphate, cell food is really important because cell food has 5 different ingredients in it, oxygen being one, minerals, electrolytes, metabolic enzymes, and vitamins. Minerals, oxygen, electrolytes, amino acids, and yeah, all that. And those are the essential things that actually the cell needs to stimulate the cell so that the cell can detoxify, and it helps the immune system. So cell food is really important, and the name implies exactly what it does. It's food for the cell. Silica is another one that's good, and that's also as a sealer for the bones, for teeth, for the gum tissue, for nails, for hair. All that is anything that is structured and that has to do with a growth, like the hair and the skin, the nails, and the bones, the ligaments, the joints. All that needs silica as a protective coating that completes it with the calcium. The bone broth, we have the bone broth, and that one has a lot of different, there's turmeric, there's collagen, there's there's vanilla, there's greens, bone broth with greens, and and there's pure. And I will tell you that the bone broth is quite amazing, and I use it in almost anything that I cook today, and it's all because you don't have to always do it in a drink. You could actually cook your rice with it. If you're making rice, you can put a scoop of that in there, and it gives you the collagen, the broth, the sulfur, and all the marrow that is in the bone broth, and it's better than having to buy something bought or maybe make it yourself, and it's ready, available for you. And you can put it if you're doing stew, chili, if you're making oatmeal, you can put it in there. If you're doing it for your protein drink, you can put it in there as well. There's so many different ways that you can put it. If you're baking, if you're making pancakes, you can actually put it in, and now you have created, where we're so conscious of carbohydrates, you can actually make pancakes that are actually protein based, that are more balanced, and so you don't have to worry about that you didn't have enough protein for that meal. Know that by putting it in any baked goods like cookies, breads, or whatever, you actually you're eating some of it on everything that you're doing. Everything that you're eating, you have a little bit in there, and that's the idea of the bone broth. Calcium, magnesium is very needed, only because magnesium is one of the minerals that are needed for the muscles to relax, and it's one of the minerals that are the most used in the body, and it's depleted. It's like it's used up so much that and we get so little, and so much is needed for so many reasons. Calcium, and you have to have it in a proportion where you need the calcium to be there, you need the vitamin D to be there, and you need the magnesium to be there in order for you to break down and deliver the calcium. Okay. That is osteoporosis. Those are the things that can be done for osteoporosis. The skin condition, vitiligo, it's a skin disorder marked by patches of skin devoid of skin pigmentation. I want to tell you, I had a gentleman that came in, a black man, and I want to tell you that he came in, well, he called me up, and I've known this fellow for many years, and comes in periodically and stuff. He called me up and he said, hey, I got a problem. I wanted to just run it through you and see what you think. And so he started telling me about the skin disorder, and he said, I'm going to come in, but I don't want to scare you, and I just want to let you know exactly what's going on, so when I come in, you're not freaked out. So when he came in, he said that he had some skin discoloration, and so when he came in, I saw him. He took his glasses off. He had a hat on, disguising, because he didn't want people to look at him. And when he came in, I said, what happened, you know? And he said, you know, I went to the doctor, and he said, they gave me this medication, and I put it on my face because I had acne, and it started to discolor my skin, and so more and more, I started doing it more and more, and I'm so self-conscious that I had to ask my employer to give me night duty because I didn't want to face the daytime people. And so he said at nighttime there were less people working, so he said I was comfortable with that. So when he came in, one of the things I had him do was I had him do the Miracle 2 products, the soap, the neutralizer, the gel, and the skin lotion. And then I had him do the cell food gel, which is the cell food that feeds the cell, like we said before, but in a gel form. And he did that. He went and he said, I would give anything if this would correct itself. Do you know that it probably took, I'm going to say, probably 3 months? He came back in, and he had it all here on his face, that whole marking completely. He got his pigmentation back. These things do happen. Things can happen. You can heal. You don't have to stay stuck in whatever it is that's happening to you. Sometimes the very things that are given for you to get better are the things that make you sick. And so the idea is that the skin discoloration, it starts to happen, and it's a very slight kind of thing. Sometimes you get one little patch, and then that's it, and then you get another patch, and then when you start seeing many of them, you start to realize, hey, this is more than just you know, fading and then they stay away from the sun because they think that's probably what did it. But you know, sometimes if you're doing skin block, sun blocker, and those things have chemicals, and when you go out in the sun it bakes it in, and so it creates some other problems. But I was going to go back. Sandalwood, myrrh, vetiver. It says apply neat 2 to 4 drops on location twice daily. The oils are always done twice a day. They're always done in the morning and they're always done at night. So that is for the skin discoloration. That is what's worked true for us here in the center, and by giving it to different people it's worked, and so we know that it works. But once you eliminate the harmful things that you're doing and you start introducing the good, know that this is what takes place. Moles, to remove moles, apply 1 to 2 drops of oregano neat directly on the mole 2 to 3 times a day. Now know that when you have like a brown spot, usually washing with soap in the Miracle 2, doing the gel as a prep, and then doing the essential oils, that creates a perfect area or the environment now for the oils to do their job better. Now, fungal nail is a big one, and we have a lot of people that come in, and you know, a lot of times they usually say that when people go to the beauty shops and they have their feet done, my son said, you know, when it's best to go in the very early morning, because they say that when you go in the very early mornings, they disinfect the foot bath thing at night. So the first one that they do, everything is disinfected. But as the course of the day goes on, everyone that comes in, they don't disinfect every single one of them. They just rinse it and clean it with soap and stuff. But so it's better, if you're going to have your feet done, better to do it early morning. Just to say that. Fungal nail infections, the best thing to do, we do have a fungal nail cream, and the best thing to do is to soak your feet with the Miracle 2 products. Then you end up putting the gel, and once you do the gel, then you put that fungal nail cream, and you do that in the morning and you do that at night. You don't necessarily have to shower or bathe every time, or do the foot bath every time you put the nail fungal cream. And there's also a tincture that is a fungus fighter that also you take internal, because a lot of times you can do something topically, but you also have to address internal so that you're fighting it 2 different ways. The essential oils as well are tea tree, lemongrass, oregano, neroli, lavender, melaleuca, so for any time you do that, know that you would then do all that, the gel first, wash the gel first. But if you're shower in the morning, not at night, then what you would do is at night, then you would do the cream again, the gel first, and then the nail, fungal nail, and then you would do the essential oils, whichever oil you're using. For feet, for corns, if you have a corn on your toes and stuff, myrrh is used, blue cypress, oregano, basil, 1 drop directly on corn 2 to 3 times a day. And you can pick any one of those. Oregano is the one that I usually tell people to use. Basil is another one, and myrrh. But there is blue cypress as well. That's good as well. Bunions are caused from bursitis at the base of a toe. And it is said that eucalyptus radiata, lemon, raven, wintergreen, apply neat 2 to 4 drops over bunion 2 to 3 times daily. These are all remedies that you can do in order to assist to help these different conditions. What was the other? Epstein-Barr. virus. We had a lady that called from Illinois, and she said she's a lady that's been with us for a long time, and she's a piano teacher, and she said that she's been battling Epstein-Barr for a long time. Epstein-Barr is a virus, also known as chronic fatigue syndrome. Epstein-Barr virus is a type of herpes virus that also causes mononucleosis. Symptoms include indigestion, upper and lower gas, poor assimilation, poor electrolyte balance, allergic reaction to foods and other substances, emotional mood swings, fatigue, irritability, and a lack of motivation, discipline, and creativity. That one is hypoglycemia is kind of the first cause of it. I think sometimes when you have one condition that surfaces and then all of a sudden you don't take care of it, then another one surfaces. And hypoglycemia, like diabetics, where diabetics are high blood sugar, hypoglycemic are low blood sugar, which means that hypoglycemic is a precursor and can render the body's susceptibility to the Epstein-Barr virus. Treat hypoglycemia and the symptom of the Epstein-Barr virus may begin to disappear. Now, it is a virus, so how do we work with a virus? You can't take antibiotics, and that is what she's been doing. Every time that she felt bad, she would go to the doctor and they would give her antibiotics, only to find out that she ended up with candida buildup, that now she's just working with all these different things that she's going through, and it's really kind of serious. And the way to do it is you need to sort of do things that are sulfur based, that are like garlic, that onions, and we have a healing tonic that has all those things. You know, there are things like in herbs, in nature, that in natural form, that we don't eat every day. It's like you don't think, oh, I want to have a garlic, or I'm going to have some onions. I mean, you don't do that. You end up including those things in a food group or a meal or a casserole or whatever. And then, of course, you don't eat those certain things every single day. You have a variety of other things. So the idea is, what if I told you that the healing tonic, all is in there, easy for you to take, and assures you that you're going to do it. So by doing the healing tonic, what happens is you end up assisting and fighting that virus, that the Epstein virus. So the whole idea is you are including all the sulfur and all the warming, the cayenne pepper, the garlic, the onions, horseradish, and all those very things that are very warming. The other thing, and it's killing the virus, because virus will not, you can't treat virus with antibiotics. And so doctors normally do that. They don't give antibiotics if you come in with a virus. They just say it doesn't work. It doesn't do anything for it. So, but for her, she would have like a bladder infection, so they would give her that. If she had an infection of whatever, they would give her that. And so she was doing that so often that she created her own mess. Inner defense is a it's thieves in a gel cap, and its inner defense is it's a product that you can take that actually kills all bacteria and germs and viruses, and so can do that. Thyme is another oil that can be done, but you can also do it in herb form. You can do clove as well. Probiotics are needed only because clearly you don't have enough of the good bacteria in order to heal. And the other one that you need is L-Acidophilus, because L-Acidophilus it's one of its own. It isn't mixed with probiotics, with that chain of probiotic 11. it's all by itself. So the idea is that you need to do it separately. You need to do one of the L-Acidophilus and one of the probiotics. Vitamins on Epstein-Barr are very important to balance your vitamins because you're not assimilating the nutrients that you're taking. You might eat perfectly great, but nothing is being assimilated, and that's the reason why you consistently stay where you're at. That's Epstein-Barr virus. Also, in that note as well, MSM and vitamin C really is very helpful, and it's sulfur, and it's what the body needs in order to kill all the toxins and the things that are lodged in the body that that your body can't get rid of, because it softens and it makes everything just fall and slip away from where it's at. And MSM is very good for skin, for nails, for hair. It gives you energy. It helps you to stay clean. It cleans, it gets rid of toxins, it also gets rid of parasites, and nothing can cling. And it heals any fissures, any lesions, anything that the body has that's not healed. MSM and vitamin C will do so, and it's very good. It keeps you regular, so you're always, and it kills candida. So okay, that is oh, breathing disorders. Okay, I got a story. I got a testimony. I had a gentleman. Well, it's the brother-in-law. It's a friend of ours. She's been with us for she's been with us forever, forever, forever. Her brother-in-law was was taken to the hospital, emergency, couldn't breathe. They ended up putting him on this respirator, and they couldn't figure out what was going on, and he couldn't breathe. So the doctors had tested him for all these different things. They couldn't figure out anything, and so she bought certain things that I told her. And you know, when you're in the hospital, you can't really do nothing. It's like you can't give the patient anything. You can't do anything. You just have to allow them to do what they do best. And so there was nothing that I could say other than essential oils. So I told her, I said, you know, I think essential oils are okay to do because I've heard from before that people have done it and they've had good results. He was in a coma, and so I said, just there's a Aroma Life oil that you can do for cardiovascular, for heart, because that's kind of what it was. And I said you can put it on his chest, and you can put it on his forehead, and just put it on his feet, in any area that's bare that you can hold and touch him and stuff. Just put it on there, and then put it on yourself, because he'll be able to breathe it, because it's in the environment, it's in the room. And anyway, they did that. And but then the wife came in the next, that was Friday when she ended up ordering the products. But then Saturday, she didn't want to wait. The sister-in-law didn't want to wait, so she came in and bought it. And when she bought it, I told her, I said, well, it's going to be shipped out. She says, well, it's too late. I don't want to get it Monday. I need it for today. So she ended up buying another bottle and took it to the hospital and worked with her husband with the Aroma Life. But in the process of talking with them, I started to ask questions as to, like, how did it get to this, and what's what, and you know. And so they were saying that I said, allergies, you know, does he have this or that? It was something that he ate, something he drank, and it came to this. They said allergies, and I said, any animals, like cats? And all of a sudden she said, yeah, we have a cat. Well, then they said, well, we have a cat that's in the house, but then we have 13 cats that are in the barn. And that's where he's at all the time. And I just went, oh my God. And then I said, is he allergic to cats? And she said, yes. And then I said, no, I said to them, get rid of the cat. To the first one, to the first cat that I thought it was just one cat, I said, get rid of the cat. It's the cat. And all of a sudden, they said, no, there's 13 cats and they're in the barn, and that's where he stays most of the time because he's actually attending the horses and the cats and all that, all the animals. So I went, oh my God, it's allergies. He's probably is loaded with the antigens of that of the cat, and he's allergic to it. And I said, that's it. And so they said, well, when he comes home, we'll have to, oh Lord, rid of the cats. I don't know, but you know what? And so I said to them, when you go to the hospital, they're going to meet. They said that they were going to meet with the doctors, and I said, talk to the doctors and tell them that it's the cats, that it's an allergy related to cats. And they'll work on that instead of guessing as to what it is, because they ran all these different tests and nothing happened. So the idea was that sometimes things are addressed too late. And anyway, he was on a respirator, and the family decided that whatever they were going to do, in fact, the doctors even said that it had prolonged and it was too late. But anyway, these are the things, if you know something, if you know that something is not right, something that you don't feel right about, you know what? Take care of it, do it, get rid of it, because it only makes life that much worse. But anyway, that was and I had all these different ideas as to working with them to see, to better it. But he started to do better. It's so funny because she told me, she said, he started to do better, but that was on a Saturday, and they were going to meet Monday. And by Monday, you know what? It's just not enough time, and it's not, and the nurses, they were so great. They said, do whatever you feel that you think it's going to work. They allowed her to do the essential oils, so that was good. I have had testimonies of people. There was one lady that the mother was in the hospital in a coma, and you know what? She called me up from the hospital and she said, Nellie, I don't know what to do for my mom. I don't know what to do. And I told her, I said, do you have any essential oils with you? It doesn't matter what it is. Anything. Whatever thing you have in your pocket. If you have essential oils, use it and wrap her feet. Put the oils on her feet. And do you know, all she had in her pocketbook was lemon. She did the lemon and she held her mom's feet, and her mom came too. Essential oils are amazing. The things that they do, the stories that I hear are amazing. I have so many that, anyway. I wanted to say nerve regenerator. The nerve regenerator for folks that have issues with the nerves that are dying, because now your feet, you're feeling that you don't have feeling on your feet, that you've got this pain going on, but you feel that that it goes numb at different times. We have an oil that's called Laurus nobilis, and it's an oil that regenerates nerve in wherever you place it, on the legs, on the feet, on the hands, wherever. That is an oil that you can apply directly. There's also a superfood that we talked about on prior shows when we did the herbs and tinctures. And Ashitaba is a superfood that it comes in a little packet, and you take and you put that in with your green drink. You know what? hypoglycemia, diabetes, the very first thing that they tell you to do is to do greens, because greens will neutralize and will feed cells and will create a balance in your system that will make you better. It's a fixer, and it's because the body is so deficient in the minerals. When you are sick, the very first thing you have to think of is a green drink or minerals already, like in the Intramin. Minerals are so important. The body is so depleted when it's sick, when you're not eating correctly. If you eat something, if you drink something green and you take minerals and you do nothing else, you'll do okay. For those people that don't eat a lot of veggies, don't like it, don't do fruits, greens are actually good to do. But I wanted to say another thing. You know, I've had a lot of people calling about issues with mouth, with gum tissue, with their tongue being very hot, with their teeth hurting, their throat, clearing their throat all the time, something lodged there. They can't, it doesn't feel right, and a lot of allergies and stuff. You know, if you have an addiction, I don't care what it is. It could be an addiction to medication. It could be a addiction to coffee. It could be to alcohol. It could be to cigarettes. It can be to chewing tobacco. Well, I want to tell you, if you have any of those conditions, I will tell you that there'll be a time in your life where you reach a certain time, a certain age, that those things will not, they won't do good for you. They'll cause so many different conditions, and it starts in your mouth. So the idea is that greens are really important. Superfoods like Hydrilla, which is actually a superfood that you include in your green drink, that actually it's a superfood that actually, for those that are vegetarians, that don't eat meat and they're not getting their B12, Hydrilla has got it in there. It's a nerve regenerator, and normally when there's a condition that surfaces, that's the first thing that is felt. And so those two superfoods are really important. And but I was going to say the acidity is number one. And whenever there's a problem with any condition, any fungal issue, anything that's going on wrong in the system, any stagnation, any numbness, any pain, any vein, any of those things, the very first thing that you have to think of is to do something that you're going to neutralize the acid. That's number one. Cold sores, the hepatitis simplex type 2, the things that are good for that are lysine, amino acid. The L-lysine is the amino acid that you're short of. The other thing is Ravensara oil. That's what you treat that with as well. So you're taking in the amino acid L-lysine, or you can do the lipstick that lysine comes with, or you can do the Ravensara as well. You can do that additional. And once you have that on hand and you keep it so that every time it happens, you take care of it, you won't have to worry. Shingles is another one. Shingles, a lot of people come in with it and having to worry about how it develops. It's chicken pox, because we all have it's chicken pox. We all have it, but it sits dormant, and at different times in our life, depending on stress levels, increase of stress, or just not doing things correct, or maybe doing a physical activity, overtaxing the body, stressing the body in certain ways, that creates stress, and a lot of times triggers the shingles to surface. And so the very thing with that is correct the soap that you're using. Make sure you're using the Miracle 2. Make sure you're doing the gel, because the gel actually smooths it out And normally, anytime you have a skin condition, you always want to put the gel on. Don't rub it until it's dry. Just put it on, glaze it on there neat. And then after that, then what you want to do, Raven Sarah is that's the essential oil that's good for shingles. And Niori is the essential oil that's also good for shingles. And Thieves is also good. If you put the gel on first, the Thieves oil will go on there really good, and you won't feel the burn when you first put it on a surface that has the shingles that's painful. But it'll actually help with that. Inner Defense is Thieves in a little gel cap, and that's also required and needed, because Inner Defense is the gel. When you take it, it actually opens up in your stomach and it works on different areas. So that is very good. Now, the other thing I was going to talk about is, you know, there's ginger is very good. Onions are very good. Manuka honey is very good. Manuka honey is one of the honey that plus 16 that is from New Zealand, and you know, it's the one honey that has the active cultures in it that will help with MRSA. It will help with strep and any virus, any colds, any flus. It can be put directly on skin for different disorders. It can be taken directly in mouth as a lozenge, because the honey is like very thick and it's got two colors. And when you take it, it dissolves in the mouth. It's the sugars that the body is lacking, but it also kills all the bad bacteria, and it does better than when prescription medication can do it. Antibiotics, Manuka honey can. It's the right sugars. Anytime you have a sore, you can actually put the Manuka on there. People do it on their faces. It nourishes the skin nice. It's anyway, Manuka honey is very, very good. And you can do it as your sugar. You can put it in tea. You can also put it in anything that calls for sugar. You can use that instead. You can also, for anybody that's dealing with, now these are remedies, natural remedies. For anybody that wants to, you know, work with cholesterol, you can actually do some orange juice, some cider. Coconut vinegar is actually good to do with this drink, because you get the benefits to lose weight, to cut the fat, to work on cholesterol. But you can do like orange, you can do honey, and coconut vinegar. You can do those three things, and you can use that, and that's actually good also for acid reflux. So instead of taking medication, you can do that. I wanted to address something else, and it's also good for cutting fat. So if you do it every morning, know for sure that you're getting the minerals from, and you can do apple cider too. I mean, people do apple cider, or they do coconut vinegar, and if they want to lose weight, coconut vinegar is probably better. And then the orange or grapefruit or lemon. You can do lemon, anything that's citric, lemon or orange juice or grapefruit, any of those with the honey and the and apple cider vinegar. And you would use the Manuka honey. Now, the other thing that I was going to talk about is macular degeneration, only because I had someone that called me up and said, and I just want to read Dr. Young. He says that for macular degeneration, it says that that Ninja Red wolfberries, Ninja Red drink, or the dry wolfberries or the goji berries, they help with macular degeneration. Also, And he says that for macular degeneration, the best prevention will be foods rich in antioxidants and carotenoids. The ninja wolfberry, the highest known antioxidant food, is also extremely high in lutein, which is vital for preventing eye health. Other foods rich in carotenoids that are also powerful antioxidants, including blueberries and spinach. Clove oil, the highest known antioxidant nutrients, can also be found, can be a frontline defense. So the Ninja Red, and it also says for cataracts, it says that clove, cataracts are a clouding of the eye lens that often comes with aging. It says wolfberries and Ninja Red helps with that. Clove oil is the most powerful known antioxidant, and when taken internally, it can slow or prevent both cataracts and macular degeneration. So that's Dr. Young saying that. I just wanted to read it so that people would know that I'm not just saying that. I am. That's what he says. And longevity is another one. But anyway, for anybody that would like more information on what we discussed tonight, you can call us at the 651-486-0525, and you can go and like us on Facebook, and also rate us on Yelp. We have a whole intro ad that we did, and if you click onto Yelp, Greer's Health, you'll be able to see the video. And we also have more videos that we have on the YouTube for those that that subscribe to it. Anyway, subscribe to the YouTube so you can watch these if you have DirecTV, because if you have DirecTV you can't see it, but you'll be able to subscribe and get it on YouTube. Anyway, goodbye. Thank you so much. Thank you.